Good evening, Dr. Panda. Congratulations on the 6 successful operations at the Asian Heart Children's Pediatric Center. This is a tremendous moment for Asian Heart, an exceptional act of generosity on the part of the hospital. Can you tell us how this fantastic project first started?
Actually, we have been doing disadvantaged or poor patients, special children operations for last 10 years. We have done more than 300 such children in the past. Actually, when this Mumbai Mirror article came out, where we came to realize that more than 700 children are waiting for surgery and close to 30 have died while waiting. It really struck all of us, and immediately I decided that at least 100 of them will go ahead and treat it free of cost without even asking for 1 rupee from anybody. And immediately I wrote to KMD as well as Municipal Commissioner, and they are pretty cooperative, and very quickly they came back to us that yes, they will be more than happy, and immediately they sent us also 92 patients list. Obviously we have to look at that list, see which are the patients who are fit for surgery, who are not anymore fit for surgery. We did a checkup, which are still doing rest of them, and immediately those patients who needed the earliest surgery and who were fit for surgery, we went ahead and started operating. So far in last 2 weeks we have operated 6 patients. Our plan is to hopefully next few months complete 100 surgeries.
Fantastic. So you're aiming at 100 children treated. Am I correct in assuming that this scale of cooperation extended by a private cardiac hospital specializing in children's pediatric surgery simply hasn't happened before?
I think others, not in Mumbai at least, in other parts I think people are doing, and I think it's important that people have to open their heart and do what they feel is right and good for the organization as well as for the community. All of us have a responsibility to do. We thought it is our moral responsibility to take up these patients. We are not planning to end at 100. Our aim is to, we have been fortunate enough that plenty of good people in this country who are ready to do and open up their wallet as well as heart for this kind of genuine causes. And we have got enough donors now who are ready to support some of these patients. And one of the donors said, Dr. Panda, I'm going to look at adding 1 more zero to that 100. Why do you want to stop at 100? I said, no, we are not planning to stop, and we are going to have to add 1 more zero. So at least the immediate near future is no more 100. Our target is to see if we can complete 1,000 patients, and then we'll see. And it's going to be an ongoing process. It's not going to be even 1,000 patients who are not going to stop, because there are close to 200,000 children who need heart surgery in this country. So 1,000 is a very, very small part of that 200,000. And if you don't operate, most of them will die within the first or 2 decades of life. And if you operate them, most of them will lead a normal life. So I think it's very important for us as a community, as individuals, to see that these people, these small children, get what they deserve.
Fantastic. You said that many donors have come forward. If there are Indians who wish to contribute, can they directly approach Asian Heart?
Yeah, I think we have got a charitable trust, and which is tax exempted, and anybody interested to donate can always approach Asian Heart, and they can always donate.
Fantastic. Tell us a little bit about the first 6 surgeries. Did they involve any unusual problems? Because Asian Heart has a history of breakthrough surgeries, unusual surgical solutions that are almost pioneering in India. Would some of these children's surgeries qualify?
They initially wanted to take up children who were critically ill and need early surgery. The first child was 6 months old and waiting for 4 months. He has got 2 holes in the heart, and her lungs are getting affected, so we operated the child first. And second child had 5 defects in the heart, and it was a complex operation, and the child was 11 months old and waiting for 9 months for surgery. So we took up both the kids. Third kid was only 15 days old. So
15 days?
15 days old, and that child you have to take up urgently, because if you don't do the surgery within 4 weeks, you cannot operate them later on. So that child had a very, very complex cause, transposition great arteries. And after that, we have done 3 more patients. All of them had holes in the heart and other complex anomalies, and they are all doing well.
My goodness. So one of your patients was just 15 days old.
Yes.
This is fantastic. And what is the oldest of the children you've operated on so far? I suppose less than a year.
Less than a year. All of them are less than a year.
So you've been operating on absolute infants, not even toddlers. They were absolute infants.
Yeah, the reason you have to operate them early. If you delay, then many of them lungs get damaged and they become inoperable.
Oh, so some of these problems can, when the children grow up, can be inoperable. So you've literally saved their lives.
5-10 years of age, but majority of them have to be operated earlier the better.
Okay, and the next 97, 95 surgeries that are going to happen are entirely of this kind of a nature, children
I mean, that's the type of patients we have to operate, and it's not 95, we have to look at 995, so hopefully we'll work on that. I'm pretty sure we'll be able to do that.
So in less than 2 weeks, you've done 6 surgeries, I suppose, in 6 months.
It's just initial phase, but my plan is to increase the speed to at least 30 to 40 per month, not only 6, 10, 12 or 15 a month. Right? We have to put up gear up the infrastructure to do this patient, because we have regular patients who also are booked, we have a long waiting list. But I'm trying to create additional infrastructure so that we don't delay treatment of these needy children.
Fantastic. You also already have a full-fledged, world-class, fully operational children's pediatric cardiac center, right?
Yes.
And how many beds does it have?
We have got 12-bedded ICU and 40-bedded children's setup.
And you usually have a pretty full complement of patients filling it up. And technically all the best surgeons in India, at least some of the best surgeons in India, work especially at your pediatric cardiac center. So, and these children get the very same treatment that fully paying children patients get, and they have the very same opportunity and success rate in life.
There is no compromise. Once the patient is inside the hospital, we do not discriminate at all. A patient who is paid full amount, a patient who has come from suite class versus patient who is completely free, and we are paying for the entire cost. Patient is patient to us, and this organization committed that once we take up a patient, we do not look at it whether the patient is free or paying the highest amount of money. The treatment, the quality of treatment, the material usage, everything is exactly same. The only difference is post-surgery, a paying patient might be staying in a suite room and a poor patient might be staying in a general ward. Beyond that, as far as care is concerned, the quality of treatment is concerned, there is absolutely no difference.
And 1,000 children to begin with are going to have access to this kind of a treatment.
We'll try our best. At least 100 I have committed, but I'm pretty sure we are going to reach 1,000. This is my next target. Once we reach 100, I said I want to take one step at a time. The 100 children we want to do completely free of cost, and then once we reach that, then we'll look at 1,000. I'm pretty sure we'll reach the second target.
Fantastic. We wish you all the best, Dr. Panda. Thank you so much on behalf of the country of India and of all our little children for the chance you are giving to so many little children.
We are all giving. It's not me. It's my team, this organization, plus all the well-wishers who have opened up their heart and their wallet for this program. Yes, the hospital is putting up a lot of infrastructure, finance, funds and staffing. Most of the doctors are not charging any 1 rupee for the treatment of this patient. But at the same time, we have got a lot of well-wishers and corporates who are coming in and opening up their wallet and heart, as I said, to support this program. And together we'll do it.
Excellent. Thank you very much, Dr. Panda. God bless you.